Hamilton once again, coming up with another recording for the lecture series on the YouTube channel. I want to appreciate your support in watching this video, and I also encourage you to put your comments or even make your contributions by tapping the likes and the dislikes. I will encourage you to put your comments for improvement of this video. However, this video is meant to encourage students to really explore further details of the topics that they are put in series. Today, I want us to proceed with lectures on antihelminthic drugs. The term antihelminthic is restricted to drugs acting locally to expel parasites from gastrointestinal tract, mainly the worms. And there are several types of worms which penetrate other tissues and are acted upon by antihelminthics. Now, the worm parasites that infect man belong to two phyla. We have the nematodes. Of course, we have the nema, nema, nemathelminths, including nematodes and roundworms. Then we have the platyhelminths, including flatworms, and are further subdivided into cestodes and trematodes. So we have the nemathelminths and platyhelminths that are the main phyla. And so infection usually occurs mainly through poor hygiene. When you are infested with worms, it means the hygiene could be poor. It could be also due to drinking of unpurified water or eating badly cooked meat from infected animals or fish. It can also, the worms can infest or enter the body through skin cuts, insect bites, swimming or walking on infected soil. And so that is how the worms get access to our bodies. And once they go there, they go with an aim to feed themselves and usually to survive, even to shelter. So they have no intention to cause harm to the body. But in the due course of their feeding and the other activities, the cells get traumatized and now cause breakdown of the body's immunity system. And that's where we now begin to have challenges. Um, Challenges on what? On the body. So the infective forms of the worms may be the adult worms. It can be the larvae stage, depending on the larval stage, depending on the genus. Um, Sometimes the infections occur after ingestion of embryonated egg or tissue of another host that contain larval forms of the nematodes, or even the larvae penetrate through the skin of the human and they enter the venules and are carried to the lungs where they enter the alveoli, sometimes causing pneumonitis. And that's where we have sometimes having um, cough that cannot be easily explained because they cause irritations to the lungs, and from nowhere you begin to cough. Um, we also see that the larvae, after reaching the trachea, they migrate, and sometimes they migrate to the glottis and they are swallowed. Then in the intestine, they attack the mucosa and using the cutting blades and muscular esophagus, they feed on the host blood and tissue fluid. And this may result in vague abdominal pain, can lead to diarrhea. It may it, it may even cause some anemia. So that means the worms can destroy a number of things or tissues within the body, like the blood tissue, the muscular tissue, and so forth. So they can cause harm. Some of them cause wounds. Some of them cause internal bleeding. And those are complications that may come and cause a person to have um, problems with the health. And that needs to be alleviated or treated. So um, there are also other ways by which the worms can get into the body, like ingestion of eggs from the soil, especially children who play with the soil. Sometimes you work on the soil without knowing the, the fingernails get some of those soil particles as you eat and you don't wash hands properly, you end up ingesting the food, the eggs. So um, those sometimes even some of them come with dust particles in the air. Then you just inhale it, and without knowing, you have already taken the worms. And so um, that is those are some of the particular ways by which the worms enter the body. Um, in many cases, the signs and symptoms of worms come with a number of indications or experiences, like having the having some kind of stomach pain, you have some nausea and vomiting, sometimes having diarrhea, even sometimes body rashes. They are there. Those are some of the signs and symptoms. You even see some of the worms moving on the skin surface, depending on the type of worm that is there. Some of them come, they even come through the anus, where the children, you see them coming out from the anal opening. That can be observed, and it is easy to know that this child or person is suffering from what? From the infestation of worms. Sometimes you experience funny itching in the anal openings and other places, even on the skin. That's when you feel there is some strange um, experience that you are having. Now, in most cases, human beings are the primary host of most worms, because they harbor the sexually active form of the worms that is produced by sexual means, and then the eggs and larvae then pass out and infect the secondary host. Now there are very many secondary hosts depending on the type of worms, and in some cases, eggs and larvae may persist in human hosts and become uh, encysted, covered with the granular tissue, giving rise to uh, cysticercosis. Eh? This is cysticercosis. And so this cysticercosis, like the eggs and larvae in muscle or viscera or even eyes and brains, they get embedded into those. And so um, the main examples of worms in the alimentary canal include: one, the tapeworm, the roundworms, and these roundworms are of various types. Um, they can be like the roundworms, like hookworm, the whipworms, and the Um, there is also ascariasis and so forth. These are examples of roundworms that can be in the what? In the intestine. And there are also some flatworms that can be found in the intestine, like the flukes, and then of course the liver flukes can move within. The tapeworms can also be there. That's when we talk of the platyhelminths, examples of platyhelminths. Um, so generally, in brief summary, I've just talked about the helminths that are divided into nematodes and platyhelminths. Under the nematodes, we put all the roundworms. So typical examples of roundworms are pinworms, whipworms, threadworms, ascaris lumbricoides, the hookworms, the filarial worms. Those are all the worms grouped under roundworms. Of course, if we go to the biology, there is a lot to identify them to be roundworms. Then the platyhelminths are the flatworms. Now we call them platyhelminths because they are flat. And typical include the cestodes, that's the tapeworms, then the trematodes, which include the flatworms. I mean the flukes. We have the liver flukes. Um, of course, all these worms have their way of surviving in the in the parasite. I mean in the host, not parasite. The host, they usually they usually develop certain characteristics to survive in the host, and those are the characteristics of most parasites. Of course, most parasites survive in the host depending on their characteristics, some of which include possession of hook, secretion of mucus, um, um, development of cuticles that cannot be easily digested by the host enzymes. Sometimes they also survive by reproducing or producing large numbers of offspring that may increase the survival of the what? Of the host. I mean of the worms. Many may be killed, but also a good number will be able to survive. That's how now the survival of the fittest comes in. Um, let's look at the nematodes. Generally, nematodes are long, cylindrical, and segmented bodies. They have long, cylindrical, and segmented bodies with the tapered ends and a mouth with the three lips, and some stay in the blood, some stay in the lymphatics or tissue. For example, the filarial and pineal worms, uh, they mostly are found in the blood and the tissues. The hookworms stay in the soil, but when they infest the body, they mostly stay in the stomach, I mean the intestinal lining. Um, Most of these infectious stages of the worms are usually the larval stage that eat voraciously. They keep, you know, um, doing so many havoc to the tissue. While the trematodes usually um, in the trematodes we have adult worms that live in venules of gut wall or even the bladder. Of course, we have the gut like the flukes. They usually they are found in the intestinal linings or even the stomach, but they eventually, when they reproduce, they find their way into the liver and also cause more harm in the liver because the intestinal content is transferred into the liver through the hepatic portal vein, and in the process they end up causing holes in in the in the liver, causing liver cirrhosis, and that's where uh, the liver gets destroyed when the number is really uh, in they are reproduced to a greater extent. They now end up causing more harm to the tissue as they feed. So generally, in trematodes, the the liver flukes can easily move to the lungs, where we have the lung flukes, others to the liver, where they now have the liver flukes, and the rest can remain in the intestine, thus leading to intestinal flukes. No, you can see the names are just according to the site of infection, otherwise the type is the same. So by means of their life cycle, we see that generally the human beings are the primary host, and when they get infested with the worms, they actually end up releasing some of the worms in their feces, and when the feces are not properly taken care of, the eggs hatch and enter the secondary hosts, sometimes where the feces are defecated just outside or in the rivers, in lakes, as other people do in those remote areas. They end up, passing these parasites to other organisms. Some of these secondary hosts can be the snails, the, 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 the sheep. Of course, these eggs, when they hatch, they can enter into a secondary stage. Some of the secondary stage can flow with water, and they are taken in with water when the animals come to take some water. Then even the snails in the water can have them attacked. Even some of the sakari transform into stages that get attached to the pasture eaten by these animals, and eventually this goes back to the secondary hosts, some of which secondary hosts are our food. Then we end up getting them back into our body. Then eventually the life cycle continues from human beings to animals and the other secondary hosts. Eventually, from the secondary hosts that are our food, we end up also consuming them, and the worm comes back to us. So we need to take good care of our feces. That's why encouraging latrine coverage or proper disposal of human feces in the community helps a lot in controlling a number of diseases, including worm infestation. And where there is a lot of worm infestation, you will find there is poor coverage of latrine. That now brings our attention to the public health issues in the community. And we expect that every individual takes it upon him or herself to ensure that human feces are properly disposed, because the human feces contain a lot of parasites and disease agents that need to be controlled. When they are properly disposed, there is a lot that is controlled in terms of diseases and infections. So the proper coverage of latrines and toilets in community usually controls spread of diseases, and also improves community health. So we encourage you to be challenged. Look back to your home, to your environment, to your village, to your children. See how the defecations are made and how human feces are taken care of. And if they are not properly done, then I challenge you to be a change agent so that you become one of those people who controls the diseases in the community. Um, that was just an interlude and extra emphasis on that. Um, when we talk about cestodes, cestodes are segmented flat dorsoventrally flat worms, and they have a head with round suckers and hooks that bear that are located in the head. In most cases, the head attaches to intestinal mucosa, and once the neck, once the head gets attached, usually the neck begins to secrete segments and grows. Now these segments now cause elongation of the flatworms, especially the tapeworms that have a typical characteristic of growing in this nature. And these segments now form what we call as the proglottis or proglottids. And these proglottids have two reproductive units. We have the male and female. So the eggs are released to the environment, and for example, we have the Tinea saginata, Tinea solium, then we have the diphylloboth, diphyllobothrium. It is difficult to pronounce it, but I'm trying to pronounce it for the sake of somebody getting the sense. But if you have the slides, you can always pronounce it better. Diphyllobothrium latum. So we also have the Hymenoleptis or Hymenolepis nana. The Hymenolepis nana is one of the species of nematodes. However, the tinea are kept in cattle and pigs, and their larvae are taken through uncooked or half-cooked meat, while the D. latum predisposes to vitamin B12 deficiency, and so it can easily infest. And so those are easily managed when they are used appropriately. Talking about the antihelminthic drugs, we see that these drugs mainly target the worms, and they're of different forms, and it depends on the site of infection for their effectiveness. We know that there are worms that are strictly occupying the intestinal lining. There are those that we find in the blood. There are those that go into other tissues. And then how the drug reaches the site depends on the property of the drug. So the drugs usually interfere with a number of processes in the worms. For example, for the drugs to act on the worm, they either interfere with, one, the energy metabolism, meaning they can inhibit enzymes that produce energy in the worms, or they act as false precursors and weaken the worm. Sometimes some of these worms interfere with the neuromuscular coordination of the worms and cause paralysis in the worms. Then eventually, those that are in the intestine are swept by the peristaltic movement and then are defecated with the feces out once they become paralyzed. Because once they are paralyzed, they cannot get attacked, they cannot move, so they become disabled and they are just at the mercy of the peristalsis in the JT. And so that's when their neuromuscular coordination is disorganized. Then there are some drugs that can cause that can interfere with the microtubular functions, which means the microtubules can be interfered with in a way that the formation of spindle fibers or the microtubules that cause the functioning of the worms are inhibited. And so that can also lead to impairment of growth in the worms, impairment in cell division, impairment of movement in the worms. Eventually the worms become disabled and they are swept out of the JT lining or out of the system, or they are simply destroyed by the macrophages if they're in the tissues and the blood. Sometimes the drugs interfere with their cellular permeability, where entrance of nutrients is impaired. Some of the worms survive in the JT lining by a form of osmosis. They don't have intestines, they don't feed, but they are just there in an utopian life. Utopian life is where everything is supplied to you. You don't even bother to use any little energy. But at the end of it all, you just stay in the environment where food is availed and the food goes into your system by osmosis. That's exactly what the tapeworms do in most cases. Their nutrients go into their system by osmosis because they occupy a very strategic position of the stomach where digested food is in the environment, like the duodenum and the small intestine, where the food is already in digested form and they are just there with their proglottis to have the food enter into their system by osmosis. And those are the ways by which sometimes the drugs interfere with the growth and the functions of the worms in our system. And eventually, when they interfere with, they end up simply becoming disabled, weakened, and eventually die. And the number of drugs that behave like that in the treatment of worms. For example, we have a drug called piperazine, which actually interferes with neuromuscular coordination. It paralyzes the helminthic muscles. The piperazine paralyzes the helminthic muscles because it blocks uh, the neuromuscular junction by causing chloride-dependent hyperpolarization, which makes the flaccid paralysis effect. And so that's how it affects the worm. Then we have ivermectin or the ivermectin, which also causes the paralysis of worms because it blocks transmission of nerve signals by interactions with the glutamate-gated chloride channels, and that is how they end up paralyzing the worms. Then we have the pyrantel, also paralyzes the helminthic muscles due to depolarization and spastic paralysis effect. There is niclosamide, which inhibits the production of energy due to uncoupling of aerobic oxidative phosphorylation especially in tapeworms, and causes decreased synthesis of adenosine triphosphate Um, then we have mebendazole. Mebendazole inhibits protein function where it binds to, to tubulins and inhibits polymerization, which means it interferes with it interferes with the formation of spindle fibers, and that of course will interfere with the movement of the worm as well as the cell division, which actually will inhibit the growth of the worm as well. So mebendazole is dangerous, and it causes disability in the worm, especially the worm becomes immobile, and if the worm does not move, then it will not be able to also feed, and it will not be able to grow, so it becomes stagnated, eventually dies. And that is how I am looking at this as one of the effective drugs. Then we have diethylcarbamazine, which enhances phagocytosis and killing um, of the cells of the worms, because usually the diethylcarbamazine sensitizes the microfilariae. It's mostly for treatment of filarial infestation. It entraps the filarial worms, the microfilaria, and usually it entraps them in reticular sites in the endothelial system, and eventually they get destroyed by the macrophages. Then we have the praziquantel that also paralyzes the, the worm, because it increases the permeability and unmasks the surface protein, which gets destroyed. We also have the thiabendazole, like it behaves like the niclosamide. Thiabendazole usually inhibits energy production and protein function by inhibiting the fumarate reductase, and it also binds to tubulin and interferes with the microtubule formation. We have suramine that inhibits the energy production, and this energy production is inhibited by inhibition of glycolysis and oxygen consumption. So these drugs usually have a way of interfering with the life of the worms. So at the end of it all, um, the worm gets disabled and is swept out of the system. Some of them get destroyed by the macrophages as well, and that's exactly how the drugs are able to help the body gain immunity and eventually recover from the trauma, and hence healing from, making the patient to heal from the worm infestation. These drugs sometimes can be classified, and in most cases, the dewormers can be classified by their painful nature. Some of them are classified according to the site of action, especially those that are said to be just acting on the intestinal lining. There are some that are systemic in nature, because once they are administered, they they are absorbed and they go into the system to take, to interfere with the action of the worms that are in the blood or other tissues. But those that are in the intestine are usually produced in a way that the drugs are not easily absorbed. They simply get into direct contact with the worms, so killing them there within the intestinal lining to be swept away with the feces. according to the chemical nature, we have drugs that are in the group of benzimidazoles. Now, the first group of or class of drugs that we put under benzimidazoles are actually a group of broad spectrum agents, including mebendazole, thiabendazole, and albendazole. All these drugs ending with zol can be ndazole. We have mebendazole, thiabendazole, albendazole. They all belong to benzimidazoles. And so the benzimidazoles are the very drugs that are first line. In most cases, we give it regularly to do public deworming. So they interfere with microtubules dependent glucose uptake by binding to free beta tubules or tubulin, that's inhibiting polymerization. So generally, mebendazole is administered orally but is poorly absorbed. The fact that it is poorly absorbed is advantageous to worms that are infested, that are found to be within the guts or the intestinal linings, so that the drug becomes, the drug comes in direct contact with the worms and destroys them. So the mebendazoles are poorly absorbed, but sometimes if we take it with fatty meals, they can increase their absorption, and so the fatty meals usually increase the absorption of the mebendazole, and that means the mebendazoles can also help in clearing some of the systemic worms. If we want the mebendazole to reach systemic circulation in high concentrations, then we must administer it with the lipid media or fatty meals. That will help them to reach the systemic circulations and destroy the systemic worms. Well, once absorbed, it is rapidly metabolized, and the products are excreted by urine and bile within 24 hours or 48 hours. But in most cases, it is generally administered within, in a single dose for pinworm, and twice daily for 3 days for hookworms and other roundworms. And usually it is indicated for treatment of trichinosis. We have the visceral larvae, migrans, enterobius, hydatid disease, and even any form of roundworms. However, because of its effect on tubulins, it is contraindicated in pregnant mothers. We don't give mebendazoles to pregnant mothers or benzimidazoles to pregnant mothers because, especially in early pregnancy, it will interfere with cell divisions in the fetus, developing fetus, and cause malformation. So we don't encourage it to be administered to pregnant mothers, and that is the reason we always say that the thumb rule for pregnant mothers is that in early pregnancy, drugs are not supposed to be administered unless the mother's life is put to risk. That's when we can now take that risk to administer the drug to the mother, because we need to protect the fetus jealously. If the mother can be able to bear certain things, sometimes we just look at it for the sake of the fetus. But when the mother's life is put in danger, that's when we now say no. We should rather save the mother than to save the fetus. As I said earlier on, the first cut is always the deepest. So we always look forward to preserve the loved ones of those people, because you can get another child, but you will not get a dear one like the one you admire most in your life. That's why we always keep that in mind. Um, the benzimidazoles, like the mebendazoles, also have the unwanted effects or adverse drug reactions. Typical are the abdominal discomforts and diarrhea. They can cause discomfort and diarrhea. For albendazoles, yes, just like any other benzimidazole, they are orally administered, though poorly absorbed. Just like mebendazole, their absorption also increases with the fatty meal, but they're extensively metabolized by fast-pass effect to sulfoxides and sulfones, and they are mostly indicated for treatment of giardia, lambelia, and hydatid disease, um, gnathostomiasis, and these drugs are mostly indicated in management of some infestations in immunocompromised patients. Uh, they can be, they can, I mean, they need to be watched closely when they are administered with other drugs, especially this drug, albendazole, interacts with concurrent treatment or concurrent use of corticosteroids, because the corticosteroids usually interact in a way that the albendazole increases plasma concentration because it interferes with the metabolism of corticosteroids. With the repeated dosing of corticosteroids in the presence of albendazole, due to non-metabolism, the corticosteroid can build to toxic level because of its inhibition of metabolism. Um, the, the albendazole can be used in combination with praziquantel to treat hydatid disease. There is also where we use dexamethasone with albendazole to treat neurocysticercosis, because the dexamethasone moderates the pain, and the albendazole clears the the worm. So similarly, the thiabendazole also is administered orally. Mostly, it is meant to be given twice a day for treatment of guinea worm infestations for 3 days, and 5 days for hookworm and other roundworms. Thiabendazole is mostly indicated for treatment of strongyloidiasis. Uh, then we also have trichostrongyliasis and the trichinosis, which is a common infestation. Most unwanted effects include anorexia, drowsiness, vomiting, vertigo. Then we also have pruritus, or even skin rashes, including uh, leukopenia. I mean, not leukopenia, but I mean the irregularities in leukocytes. I think it affects the generation of some of the white blood cells, leading to abnormal development or even reduction in number. And that's what we call as leukopenia. Another drug that we commonly use as a praziquantel in their pharmacokinetics, we see that they are highly effective broad spectrum agents for management of schistosomiasis and cysticercosis. This drug disrupts calcium hemostasis by binding to protein um, kinase sites of voltage-gated calcium ion channels and parasites. This leads to paralysis. Actually, it is a way of causing paralysis. Um, in most cases, it can also lead to long contractions, thus causing death. Now, it also affects the Sakari form that enters the skin in a way of impairing the calcium channels and other uh, voltage-gated ion channels which are related to the normal function of the cells. Um, the drug can disrupt the tegument of the parasite, exposing the novel antigen, thereby sensitizing the host's immunity to act against the parasite. So they cause attraction of the destroyers or the scavengers to destroy these parasites in the body. Now, on oral administration, it is well absorbed, and much of it is metabolized to active metabolite after first pass effect and finally excreted through urine. Usually, its half-life is within 60 to 90 minutes. That's almost 1 or 2 hours, and it is useful. Um, Praziquantel is mostly indicated for management of trematodes and cestodes infestation like schistosomiasis, hereditary disease, cysticercosis, and can be given to pregnant mothers and lactating mothers because it doesn't have much effect on these people because their their secretion in breast milk has not been detected, and it does not cross the placenta, so it is safe in pregnant mothers and lactating mothers. However, the drug is found to cause JT upset. It can cause muscle and joint pains. It can also cause dizziness, low-grade fever, and skin eruptions. And so we should be aware of these adverse effects. Niclosamide is a second-line drug for tapeworms after praziquantel. It irreversibly usually damages the scolex of the worm, thereby disengaging the worm uh, from the intestinal mucosa and causing expulsion of the scolex or the whole worm. It is administered orally after fasting all night, followed by purgatives in 2 hours to complete expulsion, because the worm that is dislodged must be expelled in the what? In the from the intestinal lining. So usually the drug is not absorbed in JT but can be absorbed by cestodes only, not nematodes. And among the adverse drug reactions, it can cause vomiting and nausea. So you can see niclosamide is not easily absorbed, so it's just for localized action to have direct effect on the worms. Then we have another common drug we use in deworming, uh, especially in treatment of ascariasis. We have levamisole. It's used to treat ascariasis lumbricoides infestation. It causes, um, it produces a nicotinic-like action, stimulating and subsequently blocking the neuromuscular junction, and that leads to paralysis in the worms, and then the worms get excreted by peristaltic movement with feces, and the drug is given orally and is rapidly absorbed and widely distributed, It crosses the blood-brain barrier and metabolizes in the liver to inactive metabolites, which is excreted via the kidney. And it has half-life of 4 hours. And due to that effect, the drug can clear the worms within the 4 or 5 hours. And the only challenge is that when it is used due to its crossing of blood-brain barrier, it can lead to dizziness, it can upset GIT, it causes skin eruption in some patients, and so forth. Another drug of interest is the ivermectin, highly effective broad-spectrum antiparasitic, and it is a drug of choice in management of floral infestation, and is very effective in onchocerciasis, even in management of river blindness. It is also good in treatment of infestation by Wachereria bancrofti, which causes elephantiasis. And so those are drugs that we need to take note of in case we have such infestations in villages. It is orally given with a half-life of 11 hours. It is thought to kill the worm by opening glutamate-gated chloride channels and increases chloride conductance. And it also binds to allosteric sites of acetylcholine nicotine receptors to cause increase in transmission, leading to paralysis, motor paralysis. So once the worm becomes paralyzed, it is swept by the flow of the tissue fluids and even the GIT linings, and it is then excreted or destroyed by the macrophages or the immune system of the body. And adverse drug reactions include skin rashes, fever, headache, pain, in the muscles and joints, and those are commonly known. As we said, we have piperas, diethylcarbamazine, which is also a piperazine derivative. It is active in floral infections, especially caused by Wachereria bancrofti and lower. It immobilizes the microflaria and alters their surface structure, making them more susceptible to be destroyed by host defense mechanism. And so it has high therapeutic efficacy and rapidly kills the microflaria. It is absorbed following oral administration, and it is distributed throughout the cells and tissue of the body except in adipose tissue. And it's partially metabolized and excreted in urine, cleared within 24 hours. However, it is contraindicated in patients with river blindness for certain reasons. It is contraindicated. As we see, the adverse drug reactions usually comes with GIT disturbances and allergic reaction. Sometimes it can cause general body weakness in the patient. In the patients. Yeah. We also have, in most cases, when these drugs are used, the worms begin to develop certain resistance to the drugs. There are common ways by which these parasites resist the effect of drugs. In most cases, they develop mechanisms in a way that they can increase secretion of worms. They can increase secretion of mucus to stop the penetration of the drugs into their body, They sometimes develop extra membranes that make them impermeable to the drugs, and sometimes they develop cocoons or hard covers that make them to be, they can develop and cause cysts that are put in cocoons, very hard to penetrate. So they change life stages to avoid the action of the drug, and that is how the parasites uh, uh, develop resistance to the drugs. Um, for example, benzimidazole resistance comes with impairments of high affinity binding to the parasite. That means they can modify the binding sites. For levomisole resistance, they they change structure of target acetylcholine nicotinic receptor. And for example, we also see that they for some of the drugs, the resistance comes as a result of change in P glycoprotein transporter in some species. So it can come with the modification of receptor sites that is targeted by the drugs. And so those are the particular facts that I wanted to share with you in anti-helminthics. If there is any other question, you may put it in form of comment, or you can even use my email to put it to me. Or for students, they can, especially for the university students, they can put it on the blended learning platform, and then we discuss it further. For other public viewers, they can reach me through my email or even my phone number. We'll always discuss and have more advice. I encourage you to be aggressive in search of such worms, because they can be nuisance in community and really affect the health of the public. Thank you for listening. Thank you for watching. You can tap the like, or you can put subscriptions wherever you wish, depending on how you feel like being close with me. This is a humble beginning, but I believe as time goes by, the video will continue to improve and have better features. Thank you, and wish you all the best studies in your endeavors, and even treatment and other conditions that you want to share with me. It's welcome. Thank you. Bye.